Hello Rachel, nice to see you. My name's Dr Ahmed, I'm one of the doctors here today. What I'd like to start by doing is asking you a couple of questions, if that's okay.
Yeah, that's fine.
Okay, so can you tell me what's brought you here today?
I've just been getting these awful palpitations.
Okay, can you tell me a bit more about them?
Yeah, they've been coming and going, lasting about, say, quarter of an hour. And, I mean, they've just really been feeling like they've just coming out my chest.
Okay. Is there anything that brings them on?
I've noticed a few things that's been bringing it on.
Such as?
Exercise, mainly, and coffee, things like that.
And when did you first notice the palpitations?
It was a couple of weeks ago now.
Okay. Anything that you were doing at that particular time that you noticed brought it on then?
No, I was doing some exercise.
Okay.
Yeah.
And how frequent are your palpitations?
Come and go, a few times a day.
All right, you said they last for about 15 minutes each time?
Yeah, roughly here or there.
Have you noticed any other symptoms in association with the palpitations, such as chest pain or shortness of breath?
Not really. I'm feeling okay apart from just these awful palpitations, really.
And do you feel dizzy when you get them?
I can do. Not so much though, no.
Have you ever passed out?
No, I haven't. No.
And never collapsed with them?
No.
Okay, all right. Can I ask you a couple of other questions, if that's okay, just about your general health? How are you generally? Are you fit and well?
I am, yes, yeah.
Okay. Any family history or any problems?
No, nothing.
What about brothers and sisters?
No, they're fine. It's just me, I think.
Okay. And do you have any serious illnesses or any significant past medical history?
No.
Okay, so never been ill or had any problems with your heart in the past?
No, I've been fine.
Okay. If you were to go for, if you were to take some exercise, would you feel unwell or do you usually feel all right if we go back prior to the last 2-3 months?
No, I'm normally quite, it's just been these palpitations the last couple of months really, okay apart from that.
And you've never collapsed when you're exerting yourself?
No, never, no.
Okay.
No.
Are you on any regular medication?
No, I'm not, no.
Okay. Do you smoke?
I don't know.
And what about anything else, any other substances used?
No.
Okay. Do you drink much in the way of coffee?
Sometimes, yeah. Maybe a cup a day or something like that.
Okay, that's great. I think we're done with the questions now. What I'd like to do is move on and examine you, if that's okay. Can I start by having a look at your hands? Just turn your hands over. Okay. I'm just going to feel your pulse. Have you ever taken your pulse during the palpitations?
No, I haven't, no.
Okay. Have you noticed if your palpitations are regular or irregular?
Yeah, they are regular, just really fast.
Okay. Just going to have a quick listen to your heart. Just sit over me. That's fine. Good. And ordinarily I'd listen to the chest, check the blood pressure and order an ECG also. Okay Rachel, having examined you and had a listen to what you had to say about the palpitations, I think we now need to just do some further investigations to ascertain the cause for your symptoms and your palpitations. You give quite a good history of fast, rapid, regular palpitations occurring and exacerbated by certain scenarios such as exercise and caffeine intake. One of the things that we need to exclude is a condition called SVT, which is not a sinister condition, but it causes the heart to go very fast and fast at times. Okay. So what I'd like to do is first start by taking some bloods, make sure you're not anemic, check your thyroid function, and also do an ECG. We'd also want to do a monitor of your heart over a period of 24 to 48 hours. You said you get your symptoms on a daily basis. Yeah. And hopefully one of these monitors that we put on will be able to capture your heart when it's in an abnormal or a fast rhythm, so we can ascertain the true nature of your symptoms. We'll also do a scan of your heart and take things from there and see you back here with the results. Okay. Do you have any questions or concerns?
No, I'm really concerned what it is. You know, I'm concerned, you know, I don't want to have a heart attack. I'm only young.
Well, that's okay. I think I can allay your fears and reassure you. I don't think that this is anything to be overtly concerned about. I don't think this is anything that's going to result in a heart attack. I think this is something that's quite common among young people. It's due to a fast regular heartbeat, something called SVT, supraventricular tachycardia, and it isn't associated with heart attacks. So I don't think you need to be worried about that. Okay? Thank you.
Thank you very much.
All right.
You mentioned a diagnosis of SVT. What are the differentials?
This lady quite clearly gave a very good history of rapid, regular palpitations occurring when she exerted herself and when she ingested caffeine. It was lasting for around about 15 minutes, and it was quite classical of a history taken from a patient with an SVT. Other diagnoses could be an SVT due to an aberrant conduction pathway, such as Wolff-Parkinson-White, and a resting ECG would therefore be important, as would a 24-hour tape. If the patient's symptoms aren't occurring on a 24-hourly basis, then a 7-day recorder or a cardiac memo would be useful in order to catch palpitations that occur less frequently. If the patient complained of irregular palpitations, then a possible diagnosis would be atrial fibrillation, though this is less common in a young patient. The commonest cause of palpitations is simply just either supraventricular or ventricular ectopics, but this is usually perceived as a missed beat or extra beats.
So what are the important questions to ask a young person presenting with palpitations?
The most important thing to ask a young person who presents with palpitations is the relation to exercise and whether or not they have any sinister symptoms such as lightheadedness, dizziness and collapse. All of these could either suggest that the SVT is occurring either very quickly or is associated with hemodynamic compromise. And it's especially important in young people who undertake sports that they're advised to avoid excessive sporting activities if they have symptoms of dizziness or collapse in association with palpitations until they're investigated further. It's important to also perform an echo to ensure a structurally normal heart